What is the best time? A lot of women want to know this best time to start hormone therapy. And many women want to know if they can continue to stay on hormone therapy if they've been on it for a while. Maybe somebody who's 65 or 70. I mean, is there a time frame here? What do you say?
Yes, there's definitely a time frame. So starting, I don't think you ever should start hormone therapy, what we call replacement therapy, before the actual menopause. But I don't think you have to wait for the definition of menopause, which is a year without menstrual period. If you're having symptoms and you're 2 months without a menstrual period, there are tests, blood tests that would show you that you're in real menopause. And with a lot of the new information, particularly about preventing dementia, which we all want to do, whatever we can do, the sooner into menopause you start, the better. So that's one point. But the other point that you're bringing up is how long can you stay? And, we are saying do not start if you're more than 10 years after your last menstrual period. And that's for a very good reason, because women that far away from making estrogen have a greater incidence of forming plaque. And if they have plaque in their arteries, estrogen might make unstable plaque and it could travel. So that's when you get the risk of, say, a stroke.
Mm-hmm.
But when you're before 10 years, you don't. Usually estrogen is such a good protector of making plaque that these women are safe. The other issue is we say over 60 for the same reason, don't start estrogen. But if you started estrogen when you were 54 or 55 because you were recently menopausal, you can stay on it over 60 because the plaque formation is prevented. And so I mean, if you're still symptomatic, that really has to be reevaluated at least once a year
Mm-hmm.
to see if you still need it, to see if you can actually lower your dose now that you're older. And that's what we do but as Dr. Margaret said, there are women who still have hot flushes at 75, at 80. And when you go off medication, we put them right back on medication.
Now, is this time frame also true for the newer medications that are non-estrogen medications?
That's an awfully good question, but we don't know the answer to that because so far the studies have only been as long as almost 4 years of study. But that is definitely not enough to know that. I would
So
say
stay tuned on that.
stay tuned on that, but they do seem very safe.